Hi everyone, in this video we'll be learning about palpation of the abdomen. So what is palpation? Palpation is a medical procedure where we examine the patient by touching. And why do we do this? We do this in order to figure out what could be wrong with them. And in this video we'll be learning specifically about general palpation of the abdomen, and we'll go into the specifics about liver palpation as well as spleen palpation. Without any further ado, let's begin.
Let's say you're a doctor and your patient has given you a lot of complaints which you believe are related to any sort of abdominal issues. You believe that you have to do an abdominal examination on the patient. So before you conduct that, this is how you're supposed to communicate to them.
So Mr. Philip, based on the symptoms that you have and the history that I have taken, I have to do an abdominal examination on you. What I will be doing is make you lie on the bed and remove your shirt. Then, with the help of my fingers, I will be touching the surface of your abdomen and do the medical examination. For this, I need your full consent. Do I have your consent, Mr. Philip?
Yes, doctor.
Thank you very much. Let's do.
Now that you have asked permission from the patient and have explained the procedure of abdomen palpation to them, you can go ahead and conduct the procedure on them. However, before you perform abdomen palpation, you have to keep the following things in mind. Firstly, always stand to the right side of the patient, because this is the proper procedure to follow for any sort of examination and not just abdomen palpation. Next, make sure that your nails are trimmed, because you don't want to cause any sort of bodily harm or discomfort to the patient during your palpation. So make sure that you keep them trimmed and tidy. Now, before you touch the patient for palpation, make sure that you use the hand sanitizer and ensure hygienic conditions so that your patient can be palpated properly. Next, make sure that your palpating wrist as well as your forearm are at the same horizontal level. There should not be any sort of excessive bending between your palpating wrist as well as your forearm. So keep them as straight as possible, even if it means bending down or kneeling by the patient's side. Next, keep your hand flat and relaxed on the abdomen with all the fingers held close to each other, and use only the palmar surfaces of the distal parts of your index, middle, ring as well as little fingers for your palpation. Your thumb is usually not involved in the procedure of palpation. Do not hold your hand in such a way that it pokes the abdomen directly, or else it will cause unnecessary discomfort. And while palpation, you're supposed to apply pressure. So when you do that, make sure the pressure is not too gentle and not too rough. It should be the right amount of force, okay? While doing the palpation, make sure that the force is enough to slightly lift your metacarpophalangeal joints, which is basically your knuckles. So make sure that while you apply force, it's the right amount of force, which ensures that your knuckles get lifted up. Throughout the procedure, in case your patient says, I feel pain or feel discomfort, make sure you make a mental note of that and then adjust your force accordingly. Before performing general abdomen palpation, you need to ensure that the patient's abdomen is open, it's exposed, and that means removing any sort of barriers or clothes before you conduct the palpation. Now, the other important thing that you have to focus on is keeping the abdomen as relaxed as possible. Because whenever we tell the patients that we're going to examine their abdomen, they get a little bit nervous, and because of that they start tensing their abdomen. And when they tense their abdomen, it is very difficult to palpate it properly and elicit anything. Now that we have learned about the what as well as the how of abdomen palpation, we'll now go into the where as well as the order that we have to follow for proper abdomen palpation. To do proper abdomen palpation, we have to divide the patient's abdomen into specific regions, because you can't just palpate any and every part of the abdomen in any order that you want. So there has to be a small discipline behind how this is supposed to be done. So we'll be guiding you through some imaginary lines on the patient's abdomen. We're not going to draw these lines for you because in the real life scenario, you can't draw on the patient. So please imagine these lines as we guide you through the procedure of demarcating them. Starting off with a point between the middle of your clavicle on either side. Imagine a line passing from that point to the mid-inguinal point way down to the groin of the patient. So this imaginary line is also known as the mid-clavicular line. So these two lines need to be demarcated first. Now we'll have to do two horizontal lines so that we can complete the demarcation. Now on the side of your hip, we have two iliac tubercles. If you palpate it, you can feel those bony prominences. Now imagine a line passing between these two bony prominences. This will be called the transtubercular line. And finally, there is one line that will pass near the upper part of your patient. It is demarcated between the jugular notch as well as the pubic symphysis. Now imagine a line passing between these 2 points. Somewhere midway on this line, along the tip of the 9th costal cartilage, draw a horizontal line with your imagination. And now this would be the transpyloric line. So now you have 4 lines in total. You have the mid-clavicular lines, 2 of them, and then you have the transtubercular line and the transpyloric line. With that, we have successfully demarcated the patient's abdomen into 9 different regions. Now these are the 9 different abdomen regions. We start from the top at the epigastric region. Then we have the right hypochondriac region and the left hypochondriac region. We now go one level below to the umbilical region, and then the left lumbar region and the right lumbar region. We then go one level below to the hypogastric region, and then the right iliac fossa and the left iliac fossa. So these are the 9 regions of the abdomen. Now we're going to tell you the order of palpation for general abdomen palpation. We start off with palpating the left iliac fossa, which is near the left tubercle end of the pelvis. Then we palpate the left lumbar region, which is at the same horizontal level as the umbilicus towards the left side. Then we palpate the left hypochondriac region, which is slightly below the left costal margin. Then we palpate the epigastric region, which is below the xiphoid process of the sternum. Then we palpate the right hypochondriac region, which is slightly below the right costal margin. Then we palpate the right lumbar region, which is at the same horizontal level as the umbilicus towards the right side. Then we palpate the right iliac fossa, which is adjacent to the right tubercular end of the pelvis. Then we palpate the hypogastric region, which is slightly above the pubic region below the umbilicus. And finally, we palpate the umbilical region, which surrounds the umbilicus. Now let's get into liver palpation. On the surface, the liver is expected to be present around the right 5th rib, the left 5th intercostal space, the left 8th costal cartilage, and the right 9th costal cartilage. So this is the expected region of the liver that you can find around on your patient's abdomen. Therefore, if the liver enlarges, we can detect it via palpation around the right costal margin. To palpate the liver for hepatomegaly, place one of your hands on the right iliac fossa in the palpation position. And you need to move from there to the right costal margin while the patient takes successive deep breaths, which means you're supposed to press or palpate when the patient takes a deep breath and then release it when the patient exhales. So palpate, inhale, release, exhale. So based on this, you'll have to do the liver palpation.
Make sure the patient's knees are bent and their abdomen is relaxed before doing the procedure. Now let's start the palpation. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. If you found any resistance in any of these regions, it is most probably a case of hepatomegaly.
The spleen is located posterolaterally to the mid-axillary line between the left 9th and 11th ribs, with its long axis along the left 10th rib. Unlike the liver, the spleen cannot be palpated. The only way the spleen becomes palpable if it's enlarged to 3 times its usual size. To palpate the spleen, first place your left hand over the posterolateral part of the left lower end of the rib cage so as to prevent the spleen from moving too much during respiration. Ensure that you do not add too much pressure with your left hand. Next, use your right hand to palpate for the spleen starting from the right iliac fossa while moving towards the left costal margin along the direction of the left 10th rib. Now make sure you palpate deeply by applying extra pressure with the tips of your fingers while asking the patient to take a deep breath every time you apply pressure. During palpation, if you can feel something solid pushing against your fingers in addition to the patient's abdominal wall, then there is a high probability that the patient has splenomegaly, which is a pathological condition.
Breathe in, breathe out. 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 During deep palpation, if you feel any resistance in these areas, it is most probably a case of splenomegaly. This brings us to the end of this video on general abdominal palpation and palpation of the liver and spleen.
We hope this video will be very useful to you from an educational and clinical perspective. Thank you
Thank you for watching.